Hi, everyone. My name's Catherine Carpenter, and I will be giving an overview of Tracking California's Data Explorer. So first, I'll give a brief introduction to the data and why we collect it, and then I'll provide a demo of navigating the Data Explorer on our website. So as Isabella mentioned, we are part of the National Tracking Network, which is funded by the CDC to provide data about environmental hazards, exposures, and health outcomes that support environmental health surveillance. The main purpose is to provide better information to understand the health of communities by making the data publicly available and easy to access online. And like Isabella mentioned, kind of the ultimate goal is for this data to be used for multiple purposes. So for example, policy development, program planning, grant applications, environmental health surveillance, community level interventions, and public health research. And this next slide kind of gives a more in detailed snapshot of the different environmental health topics that we report on. So they include air quality, asthma, birth defects, cancer, carbon monoxide poisoning, childhood lead poisoning, COPD, heat-related illness, heart attacks, and maternal and infant health. And the measures are defined and standardized by the CDC and vary by topic. I would say a majority of them kind of look at number of cases or rates of emergency department visits or hospitalizations. And most of the measures are reported at the county level, although we do have a few sub-county rates. So for example, asthma, COPD, and maternal and infant health. When we can, we do try to report on subpopulations based on age, race and ethnicity, and or sex. For most years, we have our data reported annually, and it covers around 20 years of data, with our most recent data being from 2022. And then lastly, for the data sources, they again vary by topic, but I would say we rely heavily on California's Department of Healthcare and access information for kind of all our emergency department and hospitalization rates. And so where can we find this data? So in the past year, we have redesigned our website, and along with this kind of created an all-inclusive data explorer tool to search for topics and interact with the data using kind of different data visualizations that include maps, charts, and tables. And so from there, I will give kind of a brief demo of our new data explorer and how you can navigate it to it from our website. Oops. Let's see. Okay, so this is our main website. We're at trackingcalifornia.org. There are a few different ways to access our Data Explorer. One is just right on our homepage. You can click Launch Our Data Explorer. You can also access it through topics. So let's say, for example, you're interested in asthma. You can click on asthma, read a little bit more about, background on asthma, how asthma relates to the environment, and then click on Explore Asthma Data if you want to directly go to the Data Explorer and look specifically for asthma data. And then the last way to access the Data Explorer is through our Data and Tools page. Which is a separate tab, and you can click on Data Explorer and it will kind of open up the Data Explorer in a new window. And when you enter the Data Explorer, you'll kind of see this initial pop-up page that gives kind of a brief tutorial about the different features. So for example, one of the main features is the query builder, which is here on the left, and then you can kind of click through to see the different features and how you can navigate the tool. We also kind of have an in-depth user guide if you want to read more about how to navigate the tool. It's in PDF format, kind of walks you through the data query and the different data visualizations that you can use within the tool. So going back to the tool, the first thing to do is click Explore the Data. And this will take you to the beginning of the query builder, and will prompt you to select a topic, and you'll just have to click on the drop-down menu. And these are kind of the topics that I mentioned earlier, and I think for this demo, we'll look into heat-related illness. So all you have to do is click on the topic you're interested in. So for this heat-related illness, and the Data Explorer will automatically populate the kind of most recent data we have for heat-related illness. And so it'll preload, but if you're interested in kind of changing the parameters, you have to kind of walk through the query builder and select the different options in the drop-down menus. So for example, if you are interested, let's say, in heat-related illness hospitalizations, you can click on that to change what data is being displayed, and it will kind of automatically update the data as you go down through these different drop-down menus. For measures, most of our measures are in rates. We have age-adjusted rates and crude rates. I usually recommend looking at age-adjusted rates. And then as you kind of go down the query builder, you can get into different subpopulations. So for example, if you are just interested in heat-related illness among males, you can click on males, and that will update the data again. For example, you can go kind of dive deeper into a subpopulation and say, I'm interested in, elderly males greater than 65 and over, and you can click on this. Now, again, will kind of refine the data even further. One thing to kind of point out as you look at these subpopulations, you'll kind of see on the map that it might not show as much data. This is just what happens when you're kind of getting into these, smaller subpopulations that might not have as many counts, and we can't, display counts less than 12. So it will kind of refine as you go. And this is, an example of, for example, if you want to refine even further by race or ethnicity, you'll see some of the groups are kind of grayed out. And if you hover over it, it will say, unavailable for current selections or subtopics. And this is just because there aren't enough counts that we can display publicly. And then another thing to note specifically about race and ethnicity, the groupings change over the years. So for example, I think 2019, moving onward, the group Asian American and Pacific Islander was actually disaggregated. So now we have two different groups, Asian American and also Native Hawaiian Pacific Islander, and that's from 2019 onwards. And then we also have multi-race was recently added in 2019. So depending on what year of data you're looking at, you can kind of see different subgroupings that are available. And then for years, most of our years for hospitalizations go all the way back to 2000. For ED visits, they start around 2005 and then go to 2022. And for geographies, most of the geographies that we have are at the county level. If you click down on the drop-down menu and just see counties, that's all we have available. But like I mentioned previously, this is where you might see, for example, asthma. We have zip code rates for asthma. So this is where you can kind of change and look at maybe a finer scale resolution you might be interested in. And then if you want to drill down further and look at specific counties, you can look at the county drop-down menu and say, for example, you just want to look at data from Los Angeles. You can click on Los Angeles and it will just show you data from Los Angeles. So that's the basis of the query builder. If you want to fully reset the query, you go to Reset Query up here and it will kind of take you back to prompting you to select a topic. If you want to kind of refine, the topic that you're already in, you can just go back to the drop-down menus and kind of change the selections for each step. So I'm just going to go back and for the rest of the demo, kind of look at, total counts by these populations. And I will go back to heat-related emergency department visits. That's a query builder. For the different data visualizations, we have a map view, a chart view, a time trend, and a table view. I would say I like using the map view to kind of look at trends or kind of patterns across the state. I think heat-related illness is, a good example of this is, you can kind of think about, what counties might be experiencing more extreme heat, and that could kind of show up in the map in some ways. Like for example, Imperial County we know has a lot of high heat days, but it also kind of helps maybe highlight some other surprises of like you might not expect some counties to have, heat related illness, and it might prompt you to think of, what other things besides temperature could be driving these outcomes. For example, access to air conditioning or other resources could be driving, higher rates of heat related illness in specific counties. So I like using the map for that. In terms of the map, kind of other basic features are the legend. Like I mentioned before, a lot of some rates are suppressed if the events are less than 12. So if you click on a county and it says data suppressed, that just means that there weren't enough counts to produce a rate for this county. And if you're using the Data Explorer on a smaller screen, you can also collapse the legend, which might be helpful for kind of navigating through the tool. You can also download an image of the map in this upper right-hand corner where it says download map. Next is the chart view. I personally like using the chart view to kind of look at counties and compare it to the state rate. So for example, these counties to the left have heat-related illness emergency department visits that are lower than the California rate, and these counties have rates that are higher than the state rate. You can also kind of sort the chart view by different categories. So you can sort by descending, and it's easily see kind of which counties have the highest heat-related illness for that year. So for example, Imperial County has the highest for 2022. Another feature you can use is kind of turning on and off the confidence intervals. So let's say you don't want to show the confidence intervals in, for example, the chart that you want to download. You can easily turn those on and off to kind of change the display. The next data viz we have is for the time trend. It's kind of a helpful way to look at trends for specific health outcomes across, over time. So for example, for heat-related illness, we can kind of see spikes in rates. This is for the state rates across California. So for example, we know that in 2006, there was a big heat wave, and we can see, a spike in heat-related illness for that year. And if you want to kind of compare different counties to the state rate, you have to go back to the query builder and actually enter in the counties that you're interested in. So for example, we've been doing a lot of work in Lake County around emergency preparedness and heat-related illness. So you could search for Lake County, add Lake County to the time trend, and kind of see how the rates of heat-related illness compare to California over the years, and kind of maybe hone in on specific years that might have had higher rates than normal, and kind of give you an idea of what might be happening in that year, and kind of guide you to maybe explore the data a little bit further. And then our last view is the table view. I would say it's pretty similar to the chart view, kind of being able to sort the data by alphabetically. If you want to sort the counties, you can also sort high to low for the rates and for the number of cases. And then it's also helpful to see kind of which counties may have been excluded due to low counts. And then from here, you can also download a CSV version of this table if you want to kind of take the data outside of the Data Explorer, do some more analyses, or work on the data on your own. You can click on export the data right here in the upper right-hand corner, and that will produce a CSV file that you can use. Other features that we have on the Data Explorer is this second panel view, which is kind of helpful if you want to look at kind of data views side by side. I had filtered for Lake County, so you have to go back to the query builder and uncheck Lake County if you want to see all the counties again. But this is just kind of a helpful view if you want to look at two data visualizations side by side. You can also click on the full extent. If you're on a small screen, it might be helpful to look at, for example, the table in full screen. And then the last feature that I wanted to highlight from the Data Explorer is this About button. So if you want to learn more about a specific topic, you can click on, for example, heat-related illness. This button will take you back to our website and give you more information on the topics page for heat-related illness or another topic. And then you can also kind of scroll through this sidebar and learn more about how the measures that we report are defined, learn more about the different aspects, for example, what are confidence intervals, difference between crude rate versus age adjusted rate, learn a little bit more about the nuances in the data that that I've mentioned previously, for example, differences in how race ethnicity categories are defined and introduced in different years. We have data sources, which I mentioned previously, and then methods. So if you specifically want to learn more about, the ICD-9, ICD-10 codes of how these cases are defined, we have them laid out here in more detail. We also have limitations about the data, and then any kind of additional data that we might have that's not displayed in the Data Explorer. So for example, for heat-related illness, we also have heat-related deaths, statewide deaths that you can click on and view in a different page. And then lastly, we have a PDF version about notes about the data if you want to download that as well. So that's the basic outline of the Data Explorer. I think we're always looking for feedback, especially as we release this new Data Explorer. We released it back in the summer and are kind of looking for feedback if anyone finds, maybe glitches, or if they're looking for data and they can't find it on the Data Explorer, please definitely feel free to email us. We do, can provide data outside of what's displayed here. So that's always an option. And we're always kind of looking to see how people are using the data and how we can make it more accessible and more usable for the work that you're doing.